Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
stages of sleep. Sleep can be divided into two stages. We have NREM sleep stage of sleep and REM stage of sleep. Now in the NREM stage of sleep, there are total 5 stages are present in NREM stages of sleep. So first NREM stage of sleep, that is non-random eye movement sleep. In non-random eye movement sleep, first is stage 0. Stage 0 is being awake. So this stage 0 constitutes around 1 to 2% of the sleep time is in stage 0. In stage 0, the patient lies down and slowly he falls into and occasional nocturnal awakening will be there. He will just lie down and slowly he will be going into sleep. Here in stage 0, the eye movements are irregular and slow rolling of eyes will be seen. EEG activity of phase 0 is mainly the alpha activity is seen if the eyes are closed. If eyes are closed, then alpha activity is seen, but if eyes are open, then we have beta activity is seen mainly when eyes are open. Then the stage 1. In the stage 1, this is called as dozing. Here the patient is slowly dozing into the sleep. In stage 1, he is in the stage 1 constitutes about 3 to 6% of total sleep time. Here eye movements are reduced, eye movements are seen, and also uh, there may be thrust of rolling is seen. Here in stage 1, alpha activity is mainly seen along with some interspersed theta waves are seen. Then we have stage 2. In stage 2 is called as unequivocal sleep. In stage 2 or unequivocal sleep, there will be little eye movement is seen, and so the patient is easily arousable in this stage. This stage 2 consists of around 40 to 50% of sleep. Here the patient will have theta waves along with some K complexes and spindles are seen in stage 2. K complexes and spindles are seen in stage 2. Then we have stage 3 sleep. In stage 3 sleep, this is called as deep sleep transition. Now the patient is slowly going into the deep sleep. Here eye movements are very few, and this will account for around 5 to 8%. Even if you try to wake up the patient, it is difficult to wake up the subject. Now here the EEG will show the deep waves, that is theta waves, delta waves are seen with some spindle activity, and K complexes are also seen. Then final stage is stage 4. In stage 4, it is cerebral sleep. In cerebral sleep, actually it is very difficult to arouse the patient in this sleep, and it constitutes around 10 to 20% of the sleep is in cerebral sleep. Here eyes are practically fixed and it is very difficult to arouse them, and night terrors occur at this stage of sleep. So in this stage of sleep, the EEG, if you do, you will see presence of delta activity is only seen, and it predominates in stage 4 sleep. So in stage 2, 3, 4 sleep, in all these, the heart rate, BP and respiration is steady in stage 2, 3 and 4, and muscles are also relaxed in this stage 2, 3 and 4 sleep. Whereas stage 3 and 4, only stage 3 and 4, we call it as steady sleep, or slow wave sleep is stage 3 and 4. Whereas stages 2, 3, 4, they have a steady heart rate, blood pressure and respiration, and the muscles are relaxed. Then we have the next type of sleep, which is rapid eye movement sleep. In rapid eye movement sleep, the eye movements are irregular because the name says they are rapid, so irregular eye movements are seen. This is the stage of sleep where we get dreams. All our dreams and nightmares will occur in rapid eye movement sleep. So this sleep, these dreams and nightmares which occur in rapid eye movement sleep, they can be recalled by the subject. Here the heart rate and blood pressure will fluctuate, and the respiration of the patient is irregular in this stage of sleep. Muscles are fully relaxed. On EEG, you will see all the waves of of all frequencies are seen in rapid eye movement sleep. Muscles are fully relaxed. Erection can occur in males, and almost 10 to 30% of sleep will be in REM sleep.
Thank you and thank you for watching.